Okay, so today we're going to be doing an examination of your heart. So to start off, we're going to be looking at the fingertips and the lips, looking for any sinusosis or any type of hemorrhaging or any type of abnormalities. Then we move on to looking at the chest structure and if we can see any type of abnormal pulsations along any of the valves. So that all looks fine to me. Once we do that, we can measure from the angle of Louis to, if I can have you look to your right and just lean back. And we can look for that jugular pulsation. So once we do that, we can place our ruler to that angle of Louis on the sternum and measure from that most superior aspect of the jugular pulsation. And it's under 3 centimeters, which is perfectly normal. So once we do this, we can take a look at the mitral valve a little bit closer. We're going to take our pen light, and if you can't see it in this position, if I could have you just take a little bit of tissue and move it away, you don't have to look that way anymore. So if you just want to take your tissue and move it away on the other side, like up and out.
Up and out, okay.
Perfect. Yeah, just like that. And then we'll shine our light obliquely across that, looking for any mitral valve pulsations. And if you can't see that, then you can have them in the decubitus position, and that should exaggerate the pulsation. So once we do that, we can move on to just looking at the pulsations as they are and palpating them. So we can move on to the aortic. Okay. And the pulmonary. And the Erb's point. Tricuspid. And if you can move your tissue again for me. And the mitral valve. Perfect. So we can also check for any heaves or lifts. We take the knife edge contacts across the sternum immediately and just feeling for any heaves or lifts. That all feels okay. So now that we've done our palpation, we can move on to actually auscultating. So we're going to start off on the diaphragm and just moving from the aortic down to the mitral valve, and then we'll reverse it using the bell. We're doing the same thing. And if you want to move your tissue for me one more time. And you can hold it just like that. And we just go the other direction with the valve. And you can let that out. That all sounded perfectly fine to me. But if we did hear any abnormalities, there's a couple tests that we can do to just check for any type of abnormalities. So if I could have you seated for me, facing me, and you can hang your legs off the table. So for this first one, we're going to be using our diaphragm. And we'll be listening right over the pulmonary valve for an S2 split, or an anatomical split. So once we're on the pulmonary valve, I can have you breathe in for me. And you can breathe out. That sounds normal. We can move on to aortic regurgitation. So again, using the diaphragm, I'm actually going to have you breathe out and hold it when I listen. So if you could breathe out. Hold it. Perfect, and you can breathe normally. So for these next two, we're going to be using the bell, and we're going to be going to the mitral valve. So if I could have you just move your tissue for me one more time. Just once we're on this mitral valve. If I could have you breathe out for me and hold it. Perfect. And then for this one, I'm gonna have you breathe out again for me, but then like tense up your core and really like push like a Valsalvic maneuver. Perfect. And everything sounds perfectly fine. And that concludes our examination of the heart.